Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, Virginia Audio Collective, and the Family Podcast Network. Podcast episodes also air each Saturday at noon and Sunday at 10 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to PCFpodcast at VHHA.com. That's PCFpodcast at VHHA.com. I'm Selena Laura, and today we're pleased to be joined by Donna Wilmoth, Chief Nursing Officer at Sentara Williamsburg Regional Medical Center, who joins us for a conversation about her career, adopting sensory-inclusive care at Sentara Williamsburg Regional Medical Center, and more. But first, welcome to the show, Donna. Thanks for being with us.
Happy to be here.
It's our custom to start each episode by getting to know our guests better. As we noted, Donna, you are the Chief Nursing Officer at Sentara Williamsburg Regional Medical Center and have served as President of the Virginia Organization of Nurse Leaders, as well as on the Virginia Capitol Trail Foundation Board. I imagine those few professional details are just part of your broader, unique personal story. So if you would, let's start off by having you share some other essential things about yourself that people should know.
Oh, absolutely, Selena. I have been a nurse for over 30 years, a registered nurse. I have worked for Sentara for 25 years, first starting my career in the Blue Ridge part of Virginia, and then about 12 years ago moved to Williamsburg, Virginia, where I have served as Vice President Chief Nursing Officer for our 148-bed hospital here. I am a double-boarded nurse executive, so I am boarded through ANCC as a Chief Nursing Officer, as well as I am a fellow with the American College of Healthcare Administrators.
So thanks so much for sharing that. So for the benefit of our listeners, we invited Donna to join us to discuss some recent recognition received by Sentara Williamsburg Regional Medical Center. Earlier this year, the hospital became the first medical facility in Virginia to be certified as sensory inclusive. That certification is provided by Culture City, an Alabama nonprofit sensory accessibility organization, which notes that 1 in 4 people have sensory needs. This may include individuals with diagnoses including autism, PTSD, early onset dementia, anxiety, stroke, and other things. With that background, Donna, can you share your perspective on the importance and benefits of having sensory-aware clinical environments as a means to provide optimal patient care?
Absolutely. Often, in healthcare, we will see patients that this might be their first visit into our facility as they are experiencing some type of, healthcare emergency. And that would range from, a small child all the way up to an elderly individual. And often, because it is their first time into the hospital, they are not familiar with alarms and announcements, and often a lot of people, interchanging information. And for somebody with a sensory disorder, it very well could be quite overwhelming and stressful for them. And on a few occasions, we've noticed that patients have came in and just really were stressed and just became overwhelmed with just the busyness. Just to share with you, Selena, on one of my observations, I was rounding on our pediatric unit and came across a little boy, a 5-year-old little boy, who he was admitted into our hospital with some abdominal pain, and his mother was there at the bedside, and she had shared that she was very concerned because he was not allowing the nurses to take his vital signs and do the much-needed treatment to be able to obtain blood samples and give medication. The mother did share with me that her 5-year-old little boy had a diagnosis of autism. So with that, I knew that we had just implemented a program with our sensory inclusion initiative to where we have tools that we can bring to the bedside to be able to help an individual with a diagnosis of autism or any sensory disorder to really help calm them, to soothe them, to act as a distractor, to allow the nurses to be able to give the much needed care that a patient might need. Also, we have 2 different rooms located throughout our facility where visitors or patients can come and go and sit in the room and wait. If they're maybe coming in for blood work or maybe a chest x-ray, they can wait in the sensory inclusion room, which is nicely set up with all kinds of, beanbag chairs and different lighting that really would, through research, causes the calming effect. And these are rooms that are soundproof to where it's not picking up on the busyness of the hospital. So it really helps the patient de-escalate and kind of calm down. So yeah, that's some of the great things that we're doing here.
Awesome. Thank you so much. And that ties perfectly into my next question. So, in terms of earning this certification, my sense is that it requires at least half of the hospital staff to complete training to recognize and respond to patients experiencing sensory overload. And you touched on this, but Sentara Williamsburg Regional Medical Center also invested resources in setting up 2 sensory rooms designed to provide a quiet, secure, and soothing environment for individuals in need of that calming environment. If you would, tell us more about the process of earning the certification and the work that went into that.
Yes, absolutely. So as you shared earlier in the podcast, we partner with a company called Cultural City, and their home base is in Alabama. They work with several different facilities across the United States, and from sports arenas to maybe your local zoo or aquariums. That would not be uncommon for you or for your listeners to be able to go into those places and see that they are indeed a sensory center. This was important to me as far as healthcare because, like I said, we often are seeing people that are very, very stressed out. They're having a healthcare emergency. So they come in, and not only was it important that we had the tools necessary to help our patients, but I needed to make sure that our staff that work here at Sentara Williamsburg, we have a little over 800 employees. So it was important for us to make sure that our staff truly understood what resources are available for the public and for the patient, and be able to properly, use those resources for them. So our staff, in order to obtain the certification, we had to undergo a training. Each individual had to undergo a training and then set for a competency test after watching the training or obtaining the training. So we had to prove competencies in sensory inclusion before we would receive the designation. I have to commend Cultural City because they were very, very strict. They want to make sure that, their resources are used appropriately. Amy, my colleague, who is also joining me on this podcast, she was instrumental in making sure that the rooms were set up with just detailed perfection, from right down to our signage to the book bags that we give to our visitors and our patients while they're here under our care. So it's very detailed. They follow through. It is something that's really important to our community.
And as a nurse leader, you have been part of a research team that published a statistical analysis in an academic medical journal about how stress, particularly in a post-pandemic environment, can result in more nurses leaving the profession. I'm curious to know in what ways your perspective as a nurse leader attuned to burnout among clinicians may translate to the effort of advancing a patient-focused initiative on sensory accessibility.
Oh, thank you for mentioning that. I mean, to me, that's a direct correlation. We, in order to make sure that our staff are successful, we have to make sure that we are giving them the tools necessary to help work with our patients, which does ultimately impact burnout or, just sheer frustration among staff if they're not able to give the patients the care they desperately need. So I truly believe it is my job as the Chief Nursing Officer to make sure that I stay current with what is happening, what is out there across our country, and making sure that I'm bringing it to our hospital and working closely with our clinical team and giving them the tools they need to be successful.
And in addition to sensory awareness, another effort Sentara pursued in recent years was to deploy more than 100 remote cameras across hospitals in the health system to help monitor patients at risk for falls, difficulty breathing, pain management, and other key issues. This innovation began with a pilot project at Sentara Williamsburg Regional Medical Center and Sentara Careplex Hospital before being expanded in 2023. You've been quoted as saying the pilot program yielded reductions in patient falls. Those results perhaps influenced the decision to expand the remote camera program. Thinking about the sensory certification, what are your hopes in demonstrating the value of that work and potentially seeing those concepts adopted at other facilities?
Yeah, well, I tell you, Selena, that was a great project, and certainly since we've done the article, we have rolled this out to all 12 of our hospitals across our system. So we have the capability to be able to have a remote patient monitoring camera. So we have 2 hubs within Sentara. We have 1 hub here in Williamsburg that monitors 6 of our hospitals, Western hospitals. So that would be our Peninsula hospitals and our hospitals in the Blue Ridge, as well as Northern Virginia. And then our second hub hub, which is located in Virginia Beach, monitors our eastern locations of our 6 Sentara hospitals. So we can monitor at one time 108 patients across our Sentara system. This is a way that we can make sure that we keep our patients safe. So it might be a patient that needs to be redirected. It's somebody that, when you're in the hospital, you're not well, you're receiving medication. You might not be as clear, be able to make clear decisions for yourself. So you might not realize you're as weak as you might be. So if a patient would try to get up to, let's say, use the restroom, the remote patient monitor can come over the intercom and talk with the patient, and while they're alerting the nurse that the patient needs help. So it's just a way to, again, a very different way to monitor those senses, from, decision making to, it could be a patient that might be hard of hearing or be, they have a sight limited, vision. So it's a way that we can have eyes on the patient at all times. Now, again, we don't monitor all patients. This is just the patient population that might need that extra support.
Thank you. And thanks so much again for being with us today, Donna. Before we let you go, we do have a tradition on the Patients Come First podcast to ask our guests a pair of fun, personal questions. To keep things interesting, we've got a list of 10 mystery questions. So please choose 2 numbers between 1 and 10, and I'll ask you the corresponding questions.
Okay, how about 2 and 8?
All right, number 2. If you were stranded on a deserted island, what 1 book, 1 album, and 1 movie would you take with you to keep yourself company? We will spot you a copy of the religious text of your choice. So other than that, what are your 3 entertainment survival kit picks?
Oh, wow. If I was stranded on an island, I would probably like to have my bike. I get on the Capitol Trail, and that's the way I reduce stress. Is I would like to have my bike on that island to where I could travel all over and explore the island, since I was deserted there for a while.
Gotcha. Any book, album, or movie that you'd like to keep yourself entertained?
A book that I recently read it's a book called The Silent Patient. Very, very good book. I would highly recommend it to all of your listeners.
Awesome. Thank you. Any movie or album?
Well, I don't watch a lot of TV, and, as far as the album, I am a strong listener to Christian radio, so I really enjoy that. So.
Thank you. And number 8, tell me one memory from your life that whenever you think of it, it makes you smile.
One memory of my life that makes me smile is just really the time that I've spent with my 2 daughters, which are now grown adults, visiting the different beaches and different summertime vacations. So that certainly makes me smile.
Thank you so much. And that will bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guests for joining us today. So thank you.
Thank you, Selena. Pure pleasure.